Welcome to Access Point, the podcast where cybersecurity meets operational strategy in mission-critical environments. In each episode, we explore the access management, digital transformation, and technology trends shaping the future of identity security. Here now are your co-hosts, Chip Hughes, Chief Product Officer, and Joel Burleson-Davis, Chief Technology Officer at Imprivata.
Welcome back, everybody, to Access Point. I'm your co-host, Joel Burleson-Davis, here with Chief Product Officer Chip Hughes. We just had a great conversation with Joel Vengco of Hartford HealthCare. What did you think about that conversation, Chip?
I always appreciate his insights. And I think, the key things that he talks about when I talk to him is everything is focused on patient, and thinking through how do we deal with it for today? How do we think about this in the future? How do we solve those type of challenges? What stood out to you?
Yeah, I think that what stood out to me is just sort of his perspective and both his future-oriented vision and integrity, right? It's like, why push? Why try to solve these hard things of bringing the consumer experience to healthcare, right? And the sort of honest answer of, it's the right thing to do, on behalf of the consumers, on behalf of the patients, and he's part of an institution that's capable of delivering that, so they should, right? That's a really, I really appreciate that sort of perspective, and I wish more leaders in all industries sort of took on that view.
And the integrity piece, that was the piece that stood out to me. Mm-hmm. It's like, hey, it's great that we're doing this, but why are we doing this? We're doing this for patients. Let's not forget that we're doing this for patients. And it's not, he doesn't even always explicitly say it, but it is always there, which I think it's true of most people in this industry. If you are in healthcare and you're providing care, you're helping these hospitals, you were probably doing it for a noble reason ultimately. And that's one of the things I said it during the interview, but I just really love about working with this group of people. It makes it special.
Yeah, totally agree.
So, cool. All right. Well, with that, I think we'll kick it over to the interview, and thanks to Joel and his time. And I will see you soon, my dear good friend.
See you soon.
Yeah, so it's Joel Vengco. Joel, I know some people call you Joel too. So, but
now that there's another Joel here,
it's going to get real confusing.
We'll make it easy.
Yeah, but obviously Hartford HealthCare. Why don't you introduce yourself?
Yeah, sure. Thanks, Chip, and thanks, Joel. So hi, everybody. I'm Joel Vengco, the Chief Information Digital Officer for Hartford HealthCare. Hartford HealthCare is the largest health system in Connecticut. Roughly 48,000 engaged employees, team members. We see I think 2 million patients of the 3 million in Connecticut. We have over 500 sites, continuing to grow, and the growth really is about creating access for our communities, and our aspiration of being the most consumer-centric healthcare system in the world really is what's driving our continued growth, partnerships, and aspirations to provide ways for our patients to receive care and wellness services from our health system. So happy to be here with you guys. Really looking forward to the conversation.
Yeah, I'm really excited. You always stimulate some new thoughts in me that I haven't had before when we have our conversations. And obviously, you're a great partner of ours, and we appreciate that. And one of the things that always stands out to me is everything that you talk about is sort of centered around providing care, right? And I think about your hospital system, everything you're doing, it's how do we drive that customer experience? How do we make sure that it's that best customer experience? You don't talk about your clinicians, I forget the term you use, partners, I forget the specific words, but it's really involved in centered around those patients and making sure that we're delivering the best care as possible, and how we use technologies to enable that. So I'm looking forward to sort of having that conversation with you publicly, because I know we do it privately quite a bit.
Well, first, let me tell you what our vision at Hartford HealthCare is: to be the most trusted for personalized and coordinated care. And what that really translates to is really, like I mentioned before, being the most consumer-centric healthcare system. And what that really means is that we need to create frictionless engagement with our patients. And we want it to be as seamless as what you and I, everyone else seems to experience when they do other things outside of healthcare, right? Watch a movie, buy something on Amazon, or any kind of hospitality service or capability. Get a ride share. I mean, these are all things that we do so much more easily now with the digital capabilities that we have, the personalization that these organizations provide to us as consumers. And so the question we ask often is, why not healthcare, and how can we do a better job at creating a frictionless, service-oriented experience for our consumers? And we say consumers because you're patients sometimes, but you're consumers most of the time, right? We like to think that we're doing a great enough job that those that we serve aren't always a patient in nature, because patient means you're sick, or there's some kind of acute issue, or you might be seeing certainly a provider or a nurse practitioner for wellness reasons. But certainly, we want you to be outside of the hospital, living your life, a full life, and hopefully, when you are engaging with us, it's easy, and you're getting the answers that you're looking for.
That's great. So, you just hit on a lot of things. What is sort of the biggest challenges, the biggest barriers right now, top of mind in terms of delivering that care from a healthcare perspective?
Well, it certainly starts with our clinicians, our providers, our nurses, and also our just overall clinical operations. Part of the reason why we have partnered with you all, and I've partnered with you guys in two of my different lives, and I think even one of the articles that was written about our partnership in the past was really about how do we make the lives of our clinicians easier so that they can get to doing the work that they're really there to do. They want to see patients, they want to care for patients, they don't want to have to log in using a password and trying to figure out what that password is, and if they need to reset it. I mean, this whole thing just creates not just frustration for the clinician, but certainly it makes the patient have to wait for them to see the clinician. And so it's a burden for the whole process. But starting with a clinician, what good is for them is, how do we get them into the tools that they need immediately, without wasting any more time, and then getting to to see the patient quickly and immediately, or having access to the information for the purpose of caring for the patients most immediately. So that to me that to us has been a game changer. And that was probably a decade ago that we put that in place, maybe more, right? And so you guys have done a great job in that regard. But of course, access to these systems, identity management has really become even that much more important with, digital and data and all of the technologies that, at one point there was a lot of reluctance to putting it in, into the clinical process. Now it's just a core part of the clinical process and workflow, but it can become the limiting factor for getting things done, both as a clinician and as a patient. So, how do we make that, process more efficient? How do we make it seamless? How do we create a passwordless situation? And how do we leverage other mechanisms for managing identities and, giving access to systems to these clinicians, but also to patients, right? Because now patients are leveraging these systems to do the same thing, or at least get access to their data, access to clinical care virtually, and more. So
yeah, and I really love your sort of vision and how you sort of think about it. One of the questions I have for some of us that have been in the industry for a while, like, do you see, thinking about sort of like where our current state, where we've come from, where we're going, do you see a path of acceleration? Are we getting ever closer to that vision that you laid out, faster and faster as we go? Or is it like, are we continuing to be in this, like, a little bit of a slog, slow progress? Because it feels like a little bit of both, maybe.
It's exactly. I was also going to say, I mean, not only do we share a name, obviously, I think we share some level of vision for this, but yeah, I mean, I think it's a bit of a slog, but I think we're getting closer, to a certain degree. I mean, I think the technology certainly caught up and are catching up. I think we have the opportunity to do this, and I think we're partnering with you guys to start to pilot or endeavor into some of these things, both on the provider front, which exists already in your portfolio, but also do so on the consumer front. Using biometrics as an example, leveraging that to really make registration more easily manageable, but also more rapid for patients to get to the place where they need to go. And there are a variety of other things that we've been talking about as technologies just get more democratized and in the hands of patients or consumers in their homes, and on devices. And so I do think with facial recognition, maybe voice in the future, and other kind of passwordless tokens or capabilities, we're definitely in a place where we have multiple combinations that we can leverage, and certainly looking forward to having you guys help us get to that place very, very quickly.
Well, I know we're excited about it too. And I think the thing that I've heard you talk a lot about that I get really excited about too is I do think the way you guys think about care is changing, right? And sort of this idea that if I'm looking for care, that is an omni-channel like experience where I need to be able to talk to a digital assistant at my house. And, if I'm an elderly patient or if I've got parents, remind me that I need to go get an appointment, or in this day and age, maybe even schedule a car for me on my behalf to go get me ready to go take me to my appointment. Versus I've had this experience not with your hospital, but my wife had some issues that we had to go back to that hospital, and just making her as comfortable as she's going through those procedures as possible. And I think the thing that I get excited about when we talk about this is that omni-channel experience is both real and it's very possible. And we just got to go, right? So whether that's face, voice, whatever those modalities are, I think that they're achievable. And it's really bringing that clinical experience, that doctor, that nurse, to the patient wherever they are, wherever we can provide sort of that care. And we're going to bring that out, I think, together. I think that's what this partnership is when we talk about it, which is exciting. So
yeah, and it's, I in our regular lives, I know we've got a number of different applications that we all try to manage. I mean, even to the point where we're, going on to Netflix and other things like in different devices and having to authenticate ourselves. But it's, in healthcare, it's a little bit more complicated than that. You can't leave a persistent sort of logged in, instance of Netflix and then just choose an avatar and hope nobody else chooses the same avatar, so that they can figure out, hey, this is what Chip's been talking about, let's call it, we have an idea called Care Companion, where we've got, an agent for the health and wellness companionship or guidance, rather, navigation for a patient. And so, if we're going to have a similar situation where you've got one, family that has a navigator for each of them, you can probably do it on their personal device, but there are other instances where you might want it on shared devices, right? Maybe an Alexa-like device that's bespoke for the health system, or a TV, but you don't want to have it so open that it's really just about, clicking on the avatar that you have, and then your daughter, your son can figure out what's going on with you, or vice versa. So, can you use different ways to authenticate somebody when they're speaking to that Alexa-like device or that agent, and they know it's you immediately, so then they don't, it doesn't end up kind of bleeding information to you about somebody else in your family. So I think we're going to get to that place where this omni-channel situation is absolutely a requisite, but you have to figure out how to manage the access to those channels, by virtue of other parts of the person. It may not necessarily just be physical. It may not be just the image. It may not just be your voice, or maybe it's a combination of those two things. And so then it authenticates you immediately. So there's some really exciting potential, and I think we're going to get to these places where we're going to have to solve those problems really, really quickly. But we're in the place right now. We're in this really fun place where it's like all of these technologies are kind of really at high velocity evolving, and so but how do we secure them in a way that we can ensure that this kind of information, this data, this access is secure, and these innovations certainly are abiding by that level of security. So we're going to get stymied by that if we don't get in front of it. But I'm hoping that you guys can solve that problem tomorrow. Maybe.
Well, we're hoping we're solving it today on some level. So we're working on it. That's for sure. No, I think it's really exciting. I think, the other thing you hit on is where this is data, and sort of, I know, at least I went to your presentation at Vive. I thought you did a great job on that. But, you're talking about what we sort of consider this idea of invisible security in some respects. It's just there. It's always on. It's not obtrusive. It's still privacy preserving. The only way that works is data. And I know that you've done a ton of work sort of dealing with data, identity data, and then also patient data, all that sort of stuff. Just would be curious if you wanted to talk a little bit about your perspective on data, where that fits into this, and sort of that transformation you've been going through as an organization.
I think as we continue down this path of this generation that's everything from they're just digital natives to now I think AI natives to everything data related. I mean, I know for my kids, it's like data is everything, and they don't realize it, but they realize it. Meaning, they know kind of what how to use that data in different ways, and they know it's, I think, at some level where it's going in and also being used. But with that all said, I think it is our responsibility in healthcare to make sure that we're securely managing that data, and also leveraging it for the purposes of things like personalization, and orchestration, as I had mentioned before. But it's a balance that you have to sort of make to be able to do all of that stuff. I mean, there's a level of sensitivity, obviously, in healthcare data that we have to understand and really kind of be very focused on. So it's at some level we want to give this data to the patients or the consumers. We want to use that with our vendor partners so that we can provide the best experience, whether it's, like with you guys, we would clearly have to share the image data and other biometric information with you at some level. Now, I know your architecture is we end up really owning that, and which is one of the reasons why I would prefer staying with you guys versus some other organizations who are doing similar things. I forget what their name is, like it's transparent or something. I forget what it's called, but it's, maybe it's way to see. I don't know. I don't remember. But, I do think that, we need to be cognizant that's kind of the balance, the fine line, right? And our patients are also, and consumers are also going to want to have access to their data. And so that's the other piece of this. So we're creating a capability that's not, that's always going to evolve. It's not necessarily, completed, but, how do you harness all that information into a single kind of repository? A lot of people have been doing that. A lot of organizations have been doing that for a long time, but I think healthcare is profoundly more difficult to bring that data together for various reasons. But, bring that data together, provide different mechanisms for accessing that data, either through APIs or, the Firestore, or maybe it's like an authenticated, way for an end user, like a consumer, to be able to have access to that data. But, we do believe that data has to be liquid, has to be accessible, so that you can do all of these different things when I started on my journey in healthcare, this was like in early 2000s. This data was locked up. It was not only locked up, it was like crappy data. It was, like you had like gender data in meds fields, med data in like problems and allergy fields, those the kinds of things that were happening. Now we're getting closer and better at really sort of putting that data in the place where they need to be, standardizing it. So, since we're refining that data, we've refined that data, curated that data. Now we got to release it to end users, to consumers of data. But how do you do that, in a manner that's safe and authenticated, right?
I'll say one of the things that keeps sort of coming to mind as I hear you talk is that, starting with this vision of like, we want to give that consumer experience for healthcare, and then lots of reasons why it's so hard and why it's so different, right? Like why providing healthcare is almost infinitely more complex than providing Netflix, which makes a lot of sense. But I also like get a sense of urgency of like, this is like the challenge we need to rise to. What do you think are the sort of the drivers of that like urgency? Like it's a noble cause, but it's hard, right? Like and it sounds great, but like delivering healthcare with a consumer experience is that's a bigger feat than building Netflix.
Well, I think that, so I may answer it in a different way, but I think
fine.
The urgency for us in healthcare is that, if we don't do it in healthcare, if the incumbent healthcare systems don't focus on the consumer, don't create that experience, don't enable this data to really optimize or enhance or transform the way that we deliver care, no doubt somebody else is going to do it, right? And we're already seeing that to a certain degree, from other non-healthcare organizations, right? But we're also seeing that with startups who are trying to do the right thing in many ways, and that's all good. They're not necessarily all successful, and it's harder than they thought. But we do have to figure out how to harness this now, and within the sort of the health system writ large, because we have, I think, the responsibility to make sure that we're providing care that's continuous and orchestrated and connected for our patients, who are, quite honestly, they've never gotten that kind of experience, and they're asking for it, and that's really what we're aspiring to do. That's how we see ourselves getting better, is to create a connected, orchestrated experience that's personalized. And the urgency is that we need to get it done for our patients, especially now. Cost of care is high. The technology is here and the data is available. So all of these things that are coming together, I think, really need to have lit a fire under a lot of us to say, how do we continue to solve this problem? We need to give folks better access to their care, better transparency and understanding of what what needs to be delivered to them, what they're what they need to be receiving. And the other part of this is the consumer themselves are actually in many ways looking for this kind of capability on their own, right? They're realizing a lot of health systems aren't quite as progressive as they should be. They're not leveraging the technology as they should be. Like AI is democratized, it's in their hands. So they're asking ChatGPT, not even ChatGPT Health, for health things, right? So there's a lot of urgency for a lot of reasons. And we, I think as the incumbent healthcare, providers, we need to really focus on doing the right thing and doing the best thing for our patients and consumers.
Yeah. I think that's the right answer, right? So that's the right thing to do, and you're in the position to be most likely deliver it on behalf of your consumers, which is, I think, a great answer.
But I do too. It's one of the things I really enjoy about this industry is I do think there's this nobleness when you really, especially when you're talking to the actual people providing that care, that people do care. Like you wouldn't just be doing this if you didn't care, because I do think it's incredibly difficult. I think the other thing, at least that I think about a lot right now, and particularly given some of the news coming out of, some of the AI driven companies, what we've seen with Anthropic, is there is a serious urgency around security and data and those pieces that has fundamentally shifted, right? Like, and, this is one of the things I'm really, Joel and I spend a lot of time on this is, hey, we want to give this omni-channel experience to this customer, but we also want to make sure that they have that right to privacy. They have the right to be forgotten if they want to be forgotten in their data sets. And now we've got to open it up to whatever these agents look like and how these agents are, whatever you're doing on that front. And Joel, I know this is something you think a lot about, but I'd just be curious your perspective on that and where that's going.
Yeah, I mean, God, that's like sort of the million, the $1 billion question, rather.
Yeah, it's definitely a B, not a.
Yeah. And I don't even know if I have a true answer to that other than, I think, so I'll give you one example. We've been experimenting with our own sort of AI agent for the better part of the last year. And, when we first started experimenting with it, ChatGPT was probably like a year old, something like that, maybe not even a year old. And so folks were still kind of enamored by patients, or consumers are enamored by it. But I think now there's after like 3 years, because it came out in November of 22, so maybe a little under 3 years. Or was it? Geez, I can't even do math anymore. It's 26, isn't it now?
Yeah,
Shoot,
about 4 years. Yeah,
like 4 years.
Oh, good.
We'll round up.
But anyway, like I think folks are more astute to, or in tune to the where, like, the data that's being consumed by AI. Like they thought it was really novel and interesting at first, but then they didn't realize stuff was being trained on the stuff that they were putting in there. Maybe it was all their biomarkers or their identities and all that sort of stuff. So now, it's interesting when we're testing these agents with consumer testers. They'll ask the agent, like, what are you doing with this data? What data are you keeping? What data are you, maybe some of them are sort of astute enough to ask, are you training on this data? And some do just ask simply, like, what data are you going to keep or use? But I do think that we need to be specifically, again, as stewards of our patients and our consumers and of their information, because just de facto, if we're going to care for them, we need to have that sort of patient-provider relationship that's solid and sacred, right? We need to be very focused on how that data is leveraged, accessed, transferred or transitioned. And so, I do think, number one, the patient owns their data, the consumer owns their data. Number two, we aren't the owners of the data, but we are, I think one of the stakeholders who ought to ensure that that's safe and secure and sacred. And so by that, I think, we need to figure out ways to not only enable our folks, sure that they know how to care for that data, they know how to secure that data through the way that they engage with our systems, but we also have to figure out how to, create that same capability and control for our consumers and patients. And, I don't know. I think that's one of the things that I'm really interested in trying to solve the problem for is, assuming we all agree that the patients and consumers own their data, how do we get them to have the ability to really control it, know where it is at any given point, know who's touching it or touched it or who's got components of it. And I don't know if we'll ever necessarily get there, but we need to get there for the sake of our patients, for sure. Because the other thing here's the other thing. I do think that there's a lot of value in the data. Obviously, I mean, we know that the data is sort of the gold, the new oil of the future, right? The new currency of the future. But is there a world in which we can truly, give the control or the keys to a consumer, a person, let's just say, to control their data and where and how it's being used, et cetera. I think that's where we need to be at some point.
It almost seems like it's a building block for us to be able to sort of innovate and push into the future in a safe way, right? In a way that protects our people.
Yeah. For some reason, I think there's like a movie or something like that where people are selling something like their data or something. Like I forget what the story is, but there's, again, it's currency that we have to figure out how each of us have to regain control of that stuff in some certain way. You know what I mean?
Yep. Nope. I think that's what we're thinking about and where this is going to go fast. And it's interesting because I do think it's bringing in more than just sort of the traditional identity stuff that we've been thinking about or talking about. It's a lot of different control planes that have to come together. And I get, identity is one of the key layers to that. I know a lot of the identity companies out there will say identity is the new perimeter or whatever. I sort of roll my eyes a little bit at that because it's been around for so long now. But there is also some truth in it, right? It's how do I make sure that consent does actually exist and that I'm using it as to make those decisions. And, I think the thing that I always take away from the conversations with you is it's like, if we're doing the right things now, where we're setting up these omni-channel digital experiences and we're putting the patient in the right position to do this stuff, then it should be easier in the future when we start talking about how do I have this relationship between a clinician accessing patient data and making sure that both sides are sort of consenting and properly authenticated. You can make those pieces work. And at least on my side, from my perspective, that's what we are continuously trying to drive to and be thinking about both in the immediate and sort of the future and where we're going with this.
Yep.
So I don't know if there's anything else you wanted to hit or Joel, anything else you wanted to ask Joel before we let him go? Because I know you're a busy guy and you got other things to do, but any final thoughts, anything else you want to hit on?
I think we hit it all, but, I mean, I'll just say this, and I think it's probably almost like Captain Obvious, but this is one of the most important things that we need to make sure we've got a good handle on, and it's ever evolving. Obviously, is how do we continuously not only define but really manage identity and access, and as we get into this world of multi-channels, multi-agents, data sort of flowing everywhere, there's got to be a way for us to really, as a consumer, really gain control of at least prospectively our data that we're putting into the ether, right? But there's still a lot to be done here, and I'd say, this is one of the key parts of the future, in addition to things like, I think this is outside of our scope of discussion, but like AI governance. But I think it's just as imperative as that. And in many ways, it's still, there's a lot of uncharted territory there. So I appreciate you guys, what you guys are doing. And I'm looking forward to continued partnership with you all and trying to figure out how we solve this problem for the sake of our consumers and our patients.
Yep.
Yeah, couldn't agree more.
Well, I know obviously you're a trusted, really valuable partner to us too. So appreciate you coming on and thanks for all you're doing and leading in this space. And as always, I really enjoyed the conversation. So thanks very much.
Yeah, thanks so much for spending the time with us.
And thanks for inviting me. Appreciate it. It's fun.
All right. We'll see you. Thanks for listening. Don't forget to subscribe, share, and follow Access Point on your favorite podcast platform. We also welcome your feedback. Please send us any thoughts, insights, or suggestions to accesspointpodcast@imprivata.com or find us on LinkedIn. Until next time, I'm Chip and he's Joel. This has been Access Point.